Our group will be doing a presentation on the Spanish influenza and the great harm that it did to the state of Texas and the military. The picture illustrated in front of you is a picture of San Antonio in 1918. At the time, San Antonio was the largest urban city in Texas. In 1910, the city had over 96,614 people, and by 1920, the population had increased by roughly 60%, exceeding 160,000 people. In addition to the civilian residents, the city contained a large military population based on Camp Travis and Camp Stanley. The Spanish flu was a pandemic of influenza in 1918 that caused the highest number of known flu deaths. More than 500,000 people died of influenza in the United States, killing roughly 29% of the United States population at this time. This affected many young, healthy people, along with many young children and elderly. As the new number of cases and deaths grew nationwide, the U.S. and Health Public Service adopted new strategies that included educating the public on the epidemic, recommending that state and local health officials report cases and provide medical and nursing relief. The influenza of 1918 was not the first epidemic that Texas had faced. Since the 18th century, epidemics of various kinds from smallpox to yellow fever had plagued the state. The difference between this disease and former diseases is that the severity of the disease was unknown. Texas physicians organized the Texas Medical Association. This supported the creation of local boards of health throughout the state. Empowered by the legislature, in 1856, city and country officials instituted quarantine regulations during epidemics. Texas authorities adopted health regulations aimed at reducing the spread of disease. In 1903, the legislature responded to tuberculosis outbreaks by requiring the disinfection of public buildings, railway cars, to prevent the spread of contagious and infectious diseases. Children and school workers infected with measles, chickenpox, mumps, or whooping cough weren't allowed to attend school. In the state of Texas, quarantines were a primitive measure to stop the spread of an outbreak of an epidemic to cities or states. In 1918, a quarantine stopped freight trains and passenger trains from traveling between San Antonio to two coastal centers.
All of a sudden, in cities and in the military camps, healthy people collapsed on the street as if they had been struck by lightning.
The spread of the influenza occurred very rapidly in military camps. This was due to the fact that troops came in very close contact with one another. General Estes ordered a quarantine of Camp Travis, which limited the access of the military base. The disease got so bad that Fort Sam Houston had 234 cases of sick nurses that could not tend to injured or sick troops.
During the course of this epidemic, nearly every known treatment was tried in hopes of finding a cure. In fact, many home remedies were used. For example, there were onions. Onions were thought to help cure the influenza virus. Castor oils, aspirins, cold baths, iron tonics, and even baking soda. It was thought that if a person had flu symptoms and they took 6 doses of half teaspoonfuls of baking soda in a glass of cool water every 2 hours, they would be cured. In Texas, most people were told that they had to wear masks. These masks of 4-ply surgical gauze were tied around the mouth and nose. All the residents were given masks by the city.
San Antonio propaganda newspapers would often give advice on protection against the flu. The newspaper articles will often state, "Cover your nose with your handkerchief when you sneeze." Promptly disinfect soiled handkerchiefs by boiling or washing with soap and water. Don't worry and keep your feet warm. Wet feet demand for prompt attention. Wet clothes are dangerous and must be removed as soon as possible. Sleep and work in clean, fresh air.
In conclusion, with the death toll high and the silent enemy lurking, people began to celebrate in the streets because they had beaten one of the worst epidemics to hit Texas.